You walk in the door, you're going to get me. You're not getting Arnold. I'm sorry. If that's your goal, if you want Chris Hemsworth, you're going to the wrong place. You're getting me.
All right, welcome into another episode of the Roane General Hospital's For Your Health podcast. We are talking through the Prescription for Your Health program here at Roane General Hospital, and we are coming at this from many different angles. We've come at this from the nutrition angle, from mental health, many different avenues, but we're going to get into the nitty-gritty today. We got a couple of guys here from the fitness center, and we're going to be talking about some heart zone training opportunities. We're going to talk about weight training, cardiovascular training, all sorts of things going into it. So I want to welcome in my two guests here today, and that is, of course, Kyle Raines, the Director of Medical Fitness here at the Fitness Center, and fitness trainer Matt White. Guys, thank you again for making the trip here. I know it's a long one from down the hall.
Yeah, thanks for having us. You know, the whole 20-some steps to get down here to our studio.
Well, it's not so much the steps that you guys had to make down here. It's getting coverage in the fitness center while you guys are here hanging out.
Yeah, it's part of the program. You know, you get your steps wherever you can, right?
Yeah.
That's how this works.
Yeah.
We're going to talk about that. We're going to talk about what it means to train in different ways. Looking forward to that. Kyle, we've spoken with you before, obviously, in our another podcast episode. But just for those who may not have seen that, I'm going to go through your history real quick here. We're going to go through Matt's history real quick so we can explain why you guys are professionals at what you do. Obviously, Kyle, you come at this from an athletic perspective. You were a tremendous high school athlete, a tremendous college athlete. You coached in college as well. Talk us through your progression from high school all the way until where you are now.
Yeah, so we talked a lot about it the our previous episode there. Big track runner in high school, led me on to college. Studied exercise science in college. Went on to coach collegiate athletes. So on top of doing that, I was also kind of doing some personal training with like your general public, the general population. Obviously there's a lot of different stuff between training your everyday Joe versus your athletes, but there's a lot of stuff that's really similar, and kind of you try to simplify some stuff down to kind of get everybody under that umbrella there.
Yeah, so Kyle obviously comes at this from an athletic background, but he has coached many different athletes, many different people in different ways. Matt, you've been a member of the fitness center here for quite a long time, but in your progression, you have gone from somebody who just kind of worked here, you have gone through a lot of training yourself in order to get yourself to a level that where you're a certified professional trainer here at the hospital. Now, you were somebody for a long time who was interested in weight training, but then the way this job changed and developed, it was almost required of you to go get the training necessary to be able to train others.
Well, I mean, you back in the day, you worked in the gym. It wasn't a real stressful job.
Yes.
It was more help people with a general workout. It was, let me take your money and then just let you go get on a treadmill, that kind of deal.
And then clean a lot of equipment.
And then clean at the end of the day. This program with this Prescription for Your Health has really changed all of that. There's so much more that's being offered, like you said, with health coaching, with nutrition, and with the level of kind of expertise you need to help people get where they need to be. You're going to get a lot of people from a lot of different walks of life coming in. You've got Kyle here, athlete. You've got me, barely an athlete in high school. I wouldn't even go that far, but there's certainly a different level here. Kyle is a guy that can tell you the X's and O's of like we're going to get into a little bit with the heart rate training. Mm-hmm. That stuff can be very specific when you're talking with athletes. It's very intimidating when you're talking about just an average person that comes in off the street that's never been in a gym before. That's where I come in.
You represent the everyman.
I represent the average guy, elite athlete, average Joe.
Well, you guys cover all the bases, obviously. And again, you guys are two of the staff members. What is the staff at the fitness center right now, as far as that's concerned? How many people do you have on staff that are certified trainers?
Yeah, so we have including us. There's 4 of us. We've got Will, another trainer down at the gym. Veronica, another trainer. She does a lot of our classes, water aerobics, silver sneakers, the grooves, all that good stuff. We also have several contract instructors that'll come in and teach classes. We got Susan Greathouse, does a lot of yogas. Kim, who's our health coach, she still teaches some yoga classes here and there. And then Cheryl Tolley, she teaches a lot of kind of a little bit more kind of circuity type stuff, some kickboxing, cardio, some Tabata classes, boot camp type stuff. So just we got try to cover all bases.
Pretty wide range of different classes that we can offer down there too.
Yeah.
Well, I wanted to talk about that because I wanted to highlight what we're going to be talking about here is specific exercising, specific types of exercising, specific levels of exercising, all based on the patient or the customer, whatever you want to call them. If they're in prescription for your health, obviously they've been sent here by a doctor or they've been referred by a doctor, however that is. You can call them a patient, you can call them a client, a customer, whatever it may be. But the goal here in this podcast, I think, is to kind of dispel some of the scary myths about walking through the door. We know that that's the first thing to do, is get somebody through the door to see you all. And it's a very challenging thing because it is a very scary and overwhelming thing. If you, specifically, Matt, if you've never been, let's say, an athlete at all, or if you've never been somebody who exercises, to look at that and to see other people doing certain things, and you look at it and you're so nervous to even make that first step, it is challenging to get people in the door. But once you get them in the door, you're able to start talking with them about this.
Well, I think one of the biggest things that the misconception of a gym is that you're walking in on Muscle Beach, California with Arnold Schwarzenegger, and it's just this big, grunting, intimidating environment. Some gyms are like that. Most of them are not. We are far from that.
Yeah.
You walk in the door, you're going to get me. You're not getting Arnold. I'm sorry. If that's your goal, if you want Chris Hemsworth, you're going to the wrong place. You're getting me. But that's one of the biggest things, though, with people is just getting through the door and getting over that fear and that intimidation of working out. And, I don't know how to use the equipment. That's what we're here for. Or I don't know where to start. Okay, let's figure it out together. Because everybody starts somewhere different.
Everybody is at their own level of fitness or lack of fitness. Now, I talked with you, Kyle, about the last podcast, about this in-body scanning that you guys do, all of these assessments that you all do for your clients. Now, again, if you're somebody who just comes in off the street and buys a membership, that's not what we're talking about. If you're doing your own thing. Now, obviously, you guys are there if somebody has questions even at that point. But this is specifically based off of this prescription for your health program. All these screenings, these initial screenings, the quarterly screenings, and the in-body assessments that you guys do, that leads you all to be able to help start designing something for each individual person. That's why those we talked about were so important.
Yeah. And, a big thing, especially on that in-body, it'll tell us, do we need to build muscle? Do we need to lose body fat? Are we good with muscle? Where we're at. A lot of people, pretty much everybody, the more muscle you have, it's not going to hurt you. So generally everybody, and we'll get more deep into it too. Essentially, we're going to want to build muscle with everybody. We sprinkle in the cardio here and there. We can play around with different heart rate zones as we go there. But we use that. I mean, that's kind of the driving force on kind of determining like what we want to do. Like I said, that in-body tells us kind of, I guess you could kind of say like some problem areas. A lot of people, we need to build some strength up in the legs. That's going to help balance. That's going to help just a lot of chronic pain, whether it's in your knees, low back, kind of stuff like that. So, building some strength in those legs, even those people that have like the crunchy shoulder a little bit. Well, well, maybe that shoulder's just a little weak. We can build some strength up in that shoulder to try to alleviate some of that pain that you maybe had for 10, 15 years, however long. So yeah, that in-body, it's a big tool to kind of determine where we need to go.
And I hear those things, and I hear you talking about specific things to target issues for individuals. Again, as Matt White said, this is not like Arnold Schwarzenegger coming in and you're challenging every single body part. What you're trying to do is this is preventative medicine, honestly, and preventative means in whatever area it is. This just happens to be fitness. And fitness, again, it's all encompassing. So I don't want to get off topic too much. I want to get into this heart rate zone training. This is something that I hadn't been extremely familiar with. Now, again, as I was talking to you guys, if you've been on a treadmill or if you've been on a cross trainer, every one of these treadmills and cross trainers, they have this little chart on their screen, on the side of their screen. It doesn't say zone training so much. It's just, okay, fat burning level, cardiovascular level. So that's my understanding of it. And I assume it's similar to that, but it's a little more in depth, I think, with this heart zone training. I'm going to let you guys say, what are the levels? What do the levels mean?
Yeah, so this heart rate zones, I mean, there's always kind of been like ranges for, as long back as people been training, I want to lose some fat, I'm going to go in this zone. I'm really trying to make a really intense workout. I'm going to kind of try to max it out or whatever, right? But these 5 zones, they're more, I guess, personalized, because you kind of take your max heart rate and that you kind of base everything off of. If you go online and look, there's all kinds of heart rate zone calculators. There's all these kind of equations you can kind of plug in to get those. A lot of times I feel like that kind of maybe overcomplicates things a little bit. A good kind of rule of thumb, if you just take 220 minus your age, that's going to be about your max heart rate, and then the rest of them is just percentages of that max heart rate. So all those are just kind of training different kind of energy systems to where you can kind of get different outcomes. All right, we want to maybe a longer, slower day. We want to burn some fat, just kind of easy day. Okay, we're going to be in like kind of this zone 2 right here, right? If we're looking to maybe I want to start getting into some glycogen stores, some carb stores, kind of burning some more intense exercise. I'm going to maybe be in this zone 4 a little bit, but they all have their separate purposes on what we want to do in each zone there.
So Matt, I'll bring you in for this because you again are directly involved with a lot of these individuals who are working out. What it reminds me of is to dispel a myth that for you to get in shape, for you to lose fat, for you to do whatever it is you're doing, that you have to be at a high level of intensity for your workouts. So people may be scared to death to get on a treadmill because they think that you guys are going to make them run for 20 minutes. They may have never run before in their lives.
I'm not going to run for 20 minutes. I'm not going to make somebody do something I wouldn't do.
Exactly.
Yeah. No, like Kyle said, there's different zones. Like what you were referring to with the old school thing on the side of a treadmill.
Yeah.
That's kind of where I came from too. There's a couple of zones. You got a fat burning zone that's 60 to 80% of your maximum heart rate. Then you've got this cardio zone where you're at 80% to 100% of your max heart rate. And like Kyle said, the simple formula: take 220, subtract your age. If you're 40 years old, 180 is what absolute max that you want your heart rate to be. If you're at that point, you're probably going to be hurting pretty good.
Geez, I walk around with that heart rate.
It feels that way sometimes, but from the myth standpoint of it, you can hit a target zone in all kinds of different ways, whether it's working with some weights, doing some silver sneakers classes. That anything that you're doing is going to get your heart rate up. If it's just walking back and forth across the floor, just the simplest things. But the intimidation of it is, it's a 5-step math process to figure out these zones.
Yeah.
It can be. This new method with the 5 zones, what was it called? Carvonin or something theory formula. I don't know.
Yeah.
Dude, it's, take this minus this, then add it back in. It's intimidating. It's hard enough for me.
So your clients don't need to know all that.
I've done this for 15 years. it's hard for me to figure that out sometimes. But I like to tell people, go with a perceived notion of exertion, which is if you're on any kind of a cardio machine, whether it's a little new step where you're just kind of pedaling along, a little bicycle, it's good for everybody to get a little bit of cardio in.
Yeah.
But can you hold a conversation with me while you're working out? And
Now,
still
this
feel
is putting it in layman's terms, which I like.
I'm going layman's terms here because that's where the majority of the people are. Can you keep a conversation with me while you're working out? You're probably in the right zone where you want to be. Are you huffing and puffing and, struggling just to kind of meander on a treadmill? Probably pushing it too hard. Let's back it off a little bit.
Yeah.
You're not coming in and going, okay, we're going to run a mile in 7 minutes. No, I don't run a mile in 7 minutes. I'm not going to make you do it either.
Yeah. So that's the easiest way to calm the nerves or fears of people. They might find out if somebody comes in, and again, it's all based on your level of individual fitness. So you may get somebody, again, as I said, who's been relatively sedentary for the majority of their adult life or the majority of their life, whatever it may be. Well, they may find that being able to carry on a conversation with you guys while doing a new step or while whatever their level is, that's where their heart rate has got to, that fat burning zone or whatever zone it is that you guys are looking for. So they don't need to be intimidated by the fact that you're going to make them do something that they can't do.
No.
What they're going to find out, I think, is they come in, they find out, if I'm carrying on a conversation, I may be feeling it a little bit in my muscles. I may be feeling a little bit, but, well, this is not overwhelming. I can do this.
Right. Well, a lot of time, too, just carrying on that conversation with somebody, and that's a big part of why people come to the gym. Once you get here and you see other people that are like you, you're like, okay, these are my people.
Yeah, these are my people.
I can relate to all of these individuals that are in here because we're all in the same boat. But if you're on two of you on a treadmill walking along next to each other and you're having a conversation, before you know it, you're a half hour in and you didn't even realize it. That goes a long way, just getting your mind on something else other than watching that timer and worrying about, am I doing that? Just get up and move.
Now that's not to say, of course, Kyle, as again, you come from a very high level, elite athletic, performance based thing. That's not to say that if you're in this program and you happen to be at a fitness level that allows you to train, let's say in that really high, hard zone training, cardio-based training, that's not to say that you can't do that.
Yeah.
If you're at that level and it's something you're looking to do at that point.
Yeah, I mean, like with all this, like with all of this stuff, not just the heart zone, but when we get into the weights and in the nutrition stuff, you're gonna get out of it what you put into it. So if you're wanting to take that deeper dive into it and really kind of dive into it, and that's where you'll really start to learn a lot. Even if you're just your average Joe, I mean, I'd suggest even maybe looking up some stuff just to kind of get a good idea, kind of get some just to get some feelers on there on what it's all about. Why would you be in this zone or whatever, right? But you can use these no matter what kind of skill sets you have, right? It's just kind of, I guess, the detail of what you know about it. Like if I told you, like, hey, just like an easy example, we're gonna hop on the bike, and if we're doing a scale of 1 to 5, 5 being the hardest thing you've ever done in your life, 1's being just walking from your bedroom to your living room, right? It's pretty easy. I want you about a 3, right? You can kind of, okay, it's a little bit challenging, but I got a good feel for it there. Then you can kind of take that person that's want to kind of take that next step. Okay, yeah, we're still at I want you at a 3, right? We're gonna run on the treadmill at a level 3 perceived exertion, right? I'm looking for your heart rate. I want to kind of be in this range. That zone 3 is going to be about your 60, 75% there. So that's nothing too crazy. I can kind of get a grasp on that, and then we can kind of go over, well, why do I want to be in this zone? I'm looking to kind of get my threshold up a little bit so I can start getting gaining some cardio, getting used to doing some a little bit more challenging stuff for a little bit longer duration there. I can, once I get some more time in this zone, I can then start to maybe go for a higher resistance for 5 minutes instead of like 3 minutes or whatever. So you can get it as detailed on it as you want, but the best way to do it, just kind of go with simple approach to it.
And again, the numbers you guys are able to calculate initially for these patients or these clients, whatever you want to call it. I try to steer away from calling them patients, but you guys you'll have the numbers yourselves in front of them, because you'll get a resting heart rate. You'll figure out what 60% is, what 70%. And so you guys can be there to help them through that. So I want to kind of transition into, not away from, but into, of course, this heart rate zone training. And Matt, you said something earlier. You said, no matter what you do in the gym, your heart rate is going to be elevated. There's always this, not always, but there's this stigma of a lot of people who say, I don't need to lift weights. There's no reason for me to lift weights. I'm going to come in, I'm going to get on my treadmill, or I'm going to get on my cross trainer, and that's all I'm ever going to do. Explain why that might be not the best for a patient.
Well, getting in there and doing that's great. It's something, but your body gets kind of stagnant with those kind of workouts, and you need to switch it up a little bit. And we hear this so much, especially with older folks too, that'll come in and say, well, I don't want to get all big and bulky.
Yeah.
It's a lot harder.
It's the Arnold
that.
Schwarzenegger syndrome again.
You get that perception of what working out is, Arnold Schwarzenegger back in the 80s. Or a Sylvester Stallone, in the Rocky
that
movies.
That doesn't just happen.
That doesn't happen overnight just because you picked up a couple dumbbells a few times. That is not how it works. And especially for people that are getting older, muscles deteriorate.
Yes.
And I've always had this notion of, why older people fall is a lot of people are one-sided dominant, and you don't even realize it. If you're right-handed, you do everything right-handed, you do everything right. When you get older and those muscles start deteriorating, the weaker ones go first, which throws you off balance.
Yeah.
You really need strength training. Everybody does. It doesn't have to be bench pressing a Volkswagen up off of you. It's do some weights, do a few, and we've got machines available for that too, that are very user-friendly, that are, once you get on them a few times, people go, well, this isn't so bad. This isn't what I thought it was. It's not Arnold. It's just a preservation of your muscle system.
And Kyle, you mentioned a little earlier when you're talking about balance with older people and having to have that muscle mass built up a little bit. And people say, why should I lift weights? Because I'm not trying to get big and bulky. Well, this is, as you said, is for preventative maintenance when it comes to that. So if somebody comes in and you're trying to explain to them, listen, we're going to put you on some machines. There's going to be some free weights. This is not going to bulk you up. This is going to help you in different ways, on top of the fact that I don't know the numbers, but could you guys guess or put a guesstimate out there of how many people that you interact with who just want to lose weight, and how important lifting weights is for losing weight?
I mean, I'd say, we've got our young guys in here that are looking to bulk up super hard, right? But I mean, a majority, 90, 95 are looking to lose weight. And you kind of get in this, I guess maybe it's a little bit more of an old school mindset. Well, if I just hammer the treadmill 45 minutes every day, boom, there it is. But you'll lose you'll burn some fat, but you're, like Matt said, you're going to kind of get stagnant at a certain point, right? So that's kind of where the weights come in. You can kind of change your body composition. That's where you start to look, those muscles kind of grow. Like, I'm not saying like bulk up grow, but those muscles are going to grow. You're going to look more toned. That's kind of something else. Like people say that they want to tone. Well, you can't really tone a muscle. It's either going to grow or shrink. What that tone look is looking like is that muscle's growing and you're losing body fat in that area, right? So it makes the appearance of being more toned.
Yeah.
But really that muscle has grown a decent bit there.
I think there's a big difference between being an unhealthy 160-pounder and being a very healthy toned 160-pounder.
Yeah. I mean, Yeah, we are looking to grow your muscles. We do want those to grow because you're gonna have one cool thing too about the more muscles you have, and I kind of forgot to mention this, but since I'm on it now, you can eat more if you have more muscles. So that's always a good.
There's a positive. If you're somebody who likes food,
yeah, you could. So there's kind of this resting metabolic rate that everybody has, right? So that's how many calories you're burning just being alive. So your body needs a certain amount of calories just in your daily activities. If you have more muscle on that frame, you're going to burn more calories. So that means you can eat more calories, right? Now that doesn't mean like, oh, Kyle said I lifted weights so I can go eat more Big Macs now.
I can have a bag of Doritos for dinner.
Well, but that just means, you're going to need more energy to kind of move around. So I think that's a pretty good benefit of getting some more muscle there too.
So it's very important, obviously, and that's what you guys will stress. Even if somebody comes in here and they're dyed-in-the-wool, hardcore, I'm not lifting weights, you're probably going to change their mindset on that by getting them started with some small exercises, some small weights, whatever it may be. And again, as Matt said, and I think this is very important because we look at the numbers here in Roane County. Obviously, we have an aging population. And so a lot of people that come in here may be referred to by their physician, may be of an older age. And so it is extremely important that they get on a little bit of a weight regimen because that attrition of those muscles is going to happen. It just does with older age. So if you can counteract that at all, that's a massively important part of this program for these people.
And the older you get, the harder it becomes to build muscle, but it's not impossible. I've seen 60, 70, 80-year-old people, when we do those in-body scans, that'll have an increase in their muscle mass. That's huge. Yeah. In nothing more than just your everyday life. Can you get to the point where, if you're so far behind when you come in, take a small victory like, can I climb this flight of stairs without getting winded? Or can I tie my shoes without having to come up for air? Those are wins.
Yeah. They may be wins in different ways.
Those are wins for everybody, but, especially as you get older.
Yeah.
And that's one of the things that I feel like Veronica does a great job with people down in the gym, is with that older population, and getting them into her classes. They hear that silver sneakers. Okay, well, that's all the old people sitting in a chair and just doing that. No, it's
Far
not.
from it.
Far from it. Yeah. Far from it. There's options. You can stay in the chair, but you get up, you move, you work on some balance. She's expanded those classes too to incorporate one where you're standing the whole time versus the ability to sit. More challenging. And there's a lot of people out there that we've had that really want to try that, and they need that. And she does a great job of bringing people in and showing them, hey, there's a lot more ways to this than just out here pumping iron like Arnold.
Well, when I hear you guys talk about this, it's full circle with me. I go back to the original podcast we did with our CEO, Doug Bentz, who is the strongest proponent for this, a prescription for your health. And he said, and I remember this very, very vividly, out of an entire hour conversation, he said, the number one goal of this whole program is to improve the quality of life. No matter where you are in your life, it's to improve that quality. And so whether you're a youngster, a middle-aged person, or if you're an aging population that we have, this program is custom detailed to each and every one of you. So that's where we want to get people involved in it. And again, it is very, very simple if you want to get involved in this program. All you got to do is, number one, for you guys, if they want, there's many avenues. We were talking with Kim Mertz, who's the director of the Prescription for Health. She said, it doesn't matter if you go into the fitness center and talk to one of you two, if you go in and you just want to talk to Vicky, the nutritionist, or if you need some mental health and you get some coaching or whatever it may be, or if your doctor prescribes it for you. There's many avenues for each and every person who lives in our community to get this help that they need. I'm not shutting down the podcast yet, but I was just thinking of that, and so I go off on certain tangents. I want to bring it back, though, because we kind of harped on cardio a little bit, because we were like, listen, you can do some weight training. You want to stay in that fat burning zone, this and that. But there are some uses for cardio. There's some very good uses. So why should somebody need to do cardio, and how do they incorporate that?
I'd say number one, heart health.
Yeah. Yeah, that heart's a muscle too. It needs work just like everything else.
So cardio, well, if you break it down, that's a base for heart, right?
Yeah.
And then vascular,
Yeah.
I mean, you could break it down that way, I suppose.
Yeah.
But it's very important, obviously.
Yeah, it's like if you work really hard your whole life to try and afford a Ferrari. Like I want to buy a Ferrari, right? So that's kind of the correlation, right? I'm working really hard to buy this, or not buy this, but to work and build this body up, right? I'm trying to build all this money, and then like you never change your oil in it, you know?
Yes.
You never work on the engine. Like you're throwing away, a couple $1 million down the drain. That's going to keep that Ferrari running longer and better. And you can incorporate it. You don't even have to necessarily do like a whole cardio day, right? That's a good way to do it. But you can sprinkle it in here and there. Like if you know you're going to hit, if Monday's like your chest day or whatever, right? Well, let's hop on the bike 10, 15 minutes like in a nice easy conversation pace, kind of get warmed up. There's 15, 20 minutes of cardio right there. So we do, and then we go and we hit our weights. I still maybe have a little bit of juice left in me. I'm gonna walk on the treadmill for 10 minutes. There's 25 minutes right there. So it adds up. I guess it's kind of daunting to kind of look at a day thinking like, man, am I really going to go into the gym and just sit on the treadmill for 45 minutes? That sounds miserable. Like I don't.
I have done that numerous times, and it is not the greatest thing in the world to.
Oh, yeah, it's awful.
Let's say it's good for you if you can do that.
Yeah.
But not the most stimulating mentally.
Yeah. You're out there daydreaming, like, man, what am I going to eat for dinner? Like, wow, how many episodes of that show can I watch tonight? Like, wonder what's going to happen on this one.
That's what I always do on a treadmill. Is like,
yeah,
how many episodes of this can I watch on my phone and keep me distracted? Like you said, we harp on cardio, but it is very, very important.
Mm-hmm.
One of the other things that this facility down here offers is the cardiac rehab.
There we go.
Yep.
That leads right into the whole preventive maintenance of this. You mentioned it earlier, Drew, we have such an unhealthy population, an aging population. It's just rural West Virginia.
Yeah.
We're always very low in every category. Whether it's tobacco usage, we're one of the highest. Obesity levels, we're one of the highest. We're not the healthiest state.
Yeah.
And Roane County and central West Virginia, the regions that we're looking at between, our neighbors in Wirt and Calhoun and Clay County, it's poor regions, and it's poor health regions. And that's one of the things that this program is trying to reach out to everybody around this community is that preventive maintenance.
Yeah.
If we can catch people when they're 40 or when they're 30 or when they're 20 and get them to know this is what happens if you don't incorporate cardio, if you don't incorporate weights, if you try to get out of that sedentary lifestyle. And we have so many of these older guys, these old farmers that have a heart attack. They come in. They go to, Patty and Courtney run our cardiac and pulmonary rehab. They're wonderful, great people. I work hard on the farm every day, but it's different.
Yes.
It's hard. Yes, it's hard work. We all know if you've ever been around a farm, you know how hard it is, but it's different. It's a different kind of exercise that your heart needs.
Yeah.
And that's getting the heart rate up, back to those zones, getting a length of time as well. I always encourage people, especially new people, get at least 20 or 30 minutes in each time you come in. If you're only going to be here 2 or 3 times a week, which is great, it's better than nothing.
Yes.
It's a good start. Every day would be better. I think the recommendation is 150 minutes of moderate exercise per week. If you break that down, okay, that's 30 minutes 5 times a week.
And that's not overwhelming at that point.
That's not bad. But it's for you. It's for your long-term health. Yeah. And try to sprinkle in a little bit of those weights just to, get over that intimidation factor. Yeah. And that's one thing we can do as trainers here is give you a little nudge. Yeah. So, well, come here and just try it with me. Yeah. I'll do it first. Now and then, okay, sit down here. Let me fix it for you. Try it. Well, that's every response. That's not so bad.
That's not as bad as I thought it was.
It's not
going
as
to
bad
be.
as you think it is.
Yeah.
But
Well,
number one, you got to get through the door.
Yeah, when you sign up for this program and you come in to see you all, I don't know if you ever thought about this when you were starting to work at this position, and now that you become a trainer, you're also kind of a therapist on site when it comes to that. You're reading people, you're calming them down before they even start some programs. You're getting them over those fears a little at a time. And again, the biggest fear is just walking through the door. Number one.
And if you can make a good first impression, a good engagement with somebody early on, it's kind of like a bartender, a therapist.
I was gonna say,
You're going to
Yeah,
stay
exactly.
here.
There's no real training for that when you were training to be a fitness trainer.
Yeah.
I don't think there was a whole lot of mental preparation for that. It's
Yeah.
just you just learn.
That just goes with the job. I mean, you figure it out. Colleagues will say it all the time. They tell me all kinds of stuff. Well, that's good.
yeah.
When people get comfortable enough, they know you, but they know you're not judging all the time. You can tell me something I'll forget before you walk out the door, probably.
Well, I'll tell you what, fellas, it's been a good conversation. Obviously, trying to dispel some of these myths behind the intimidation of working out, if you want to call it that, however it is you're going to be doing it. But again, the number one goal is just to try to get people to understand that you guys are here as a part of this program to help out. And you have the knowledge and you have the technology that will help you guys help these patients, these clients, whoever they are. And we invite people, all they have to do is, again, get over that number one fear, and that is walking through the door. You don't even have to open the door here, by the way.
Yeah, they're automatic.
Automatic
They'll
doors.
open for you.
So you don't have to worry about it.
Yeah.
Let's assuming they work, they're mostly there. Well, again, Kyle Raines, Matt White, thank you guys for being here with us for this podcast and helping us get this information out to the general public. Our goal, as always, folks, is just to try to let you know what is happening with Prescription for Your Health. It's a wonderful program. Make the decision today to get a hold of some of these people here. It doesn't have to be Matt or Kyle. It could be somebody else we've talked to throughout these podcasts. We just want you to have the opportunity to know that you have people here who are ready to help you out. They have the knowledge, they have the technology, and they have the facilities needed if you want to make that first step through the door and be healthier. And that's what Roane General Hospital is trying to do with this program. It's a daunting task.
Oh, yeah.
It is a very, sometimes people would say, overwhelming. When, as Matt said, you look at the numbers here in Roane County and in the surrounding counties. But that's why Roane General Hospital was here to try to cut their nose off to spite their face. They're like, we're trying to lose business in the main hospital because we want people not to have to be coming in with all these issues. And that's why you guys are a part of this. Great stuff here. I'm very thankful that you guys were here today.
Yeah, thanks for coming in, having us in, listening to us talk and yap about stuff. So it's always good.
Yeah, we could yap for a couple more hours if
Yeah.
you really had
As
time.
always.
But,
Yeah.
Well, we'll have another podcast again next Friday. We invite you guys to tune in for that. Till then, I'm Andrew Miller. Have a wonderful day.